definition. What is the formal definition of this fetal growth restriction? So the formal definition, and this I am quoting several guidelines. Now, first of all, before I begin, what are the guidelines? You would ask me what are the guidelines that I'm going to be quoting, or what are the various sources that I'm going to be quoting today. So the various sources that I'm going to be quoting today are going to be, first of all, the recent most 2024 Green Top guideline on fetal growth restriction that was released by RCOG. Next, I'm going to be using the practice bulletin on fetal growth restriction of ACOG, that is American College of Obstetricians and Gynecologists. Then I'm going to be using Indian FOXY guidelines. In fact, a lot of the pictures that I'm going to be using today are from our FOXY guidelines, and those FOXY guidelines have been derived from ISUOG, International Society of Ultrasound in Obstetrics and Gynecology. And of course, the Bible, the one book that I definitely will always refer for every single session of mine, that is Williams, the latest edition. And lastly, another interesting book, a very nice book for understanding, but a book that I wouldn't say that you should be using first up. You should be using it once you have understood the topic a little bit. A very good book though, Areas. So from all these sources, I've charted today's session, and I've made it in the form of a flowchart so that you, whenever you just want to write an answer or go into your exams, you can just watch this 1.5 hours. I don't know how much would be the length video, and be prepared for it. So first of all, what is the definition? So एक definition वो है जो समझाता है what is FGR. The other definition is how is FGR diagnosed. So the first is going to be how it is defined verbally through words. So it is said to be a pathological condition where the fetus hasn't achieved. I'll be continuously looking at my YouTube channel. So basically on our YouTube Conceptual channel, you would be getting a chance to ask me whatever queries you have. I'll keep on reading them. I'll be answering them as and how I keep getting them. So where the fetus hasn't achieved its optimal or just growth potential. And this is irrespective of its size. What do I mean by this? Now, what does this mean? I will tell you. Before that, let me just add another point. This, in a way, means that the fetus does not have to be small. Need not be small. और small को दूसरा term में दूंगा low birth weight to be called growth restricted or to be diagnosed as FGR. So basically, apna LBW, that is low birth weight definition, is less than 2.5 kgs. Of course, we know that. So is it likely that a baby that is of 2.8 kg can be called as one who has growth restriction? Definitely, it can be called. So can a baby which is 1.8 kgs. But even the other way around, a baby that is, let's say, of 1.8 kg may be normal and not growth restricted. So it goes two ways, both ways. So broadly, what I'm going to say is that fetal growth restriction is not equal to small for gestational age. So now what are these two concepts? You all have always heard of these two concepts. Let us just go into a bit of detail for this one. So small for gestational age is a baby which is for that gestational age smaller than its optimal size. जो अपने growth के charts बनते हैं, curves बनते हैं, उसके हिसाब से कम है. Whereas fetal growth restriction refers to a pathological process because of which the baby is small. So what are the various reasons why there should be SGA? But before going there, I mentioned that this is a verbal definition. What is the official definition? Now, official definition का अगर मैं तुम लोगों को फोटो या फिर ये दिखाऊंगा, अरे गया किधर? Yes. So if I'm going to be showing you all this, you would see that यहाँ पे, I'll just increase the size here. You would see several definitions that have been given for SGA and FGR. So the latest one, which happens to be my ISUOG and FIGO. Now, FIGO is a body of just OBGYNs, but ISUOG is a body of OBGYNs who do ultrasound. So ultrasound wala wo criteria rahega. So the definition of SGA, as has been quoted as recent as 2020 by both of them, is, let me just talk about FIGO right now. Effective fetal weight or birth weight below 10 centile for gestational age. So SGA is basically when the fetal weight is less than 10 centile. Now what is the centile? Centile मतलब क्या होता है? अगर मैं population को जो भी अपना population 1 crore, 2 crores, 10 crores, 1 billion, वो हर एक बच्चे को अगर मैं सेंटाइल्स में डालूं, मतलब उसको मैं 100% में डिवाइड करूं, सो अकॉर्डिंग टू द बर्थ वेट्स, सो इन द लोअर 10% जो होते हैं बच्चे, इन द लोअर मोस्ट 10% babies are going to be called as the ones who are below 10 centile. So small for gestational age is less than 10 centile. Anything less than 10 centile. Whereas the definition of FGR is that the small fetus, matlab less than 10 centile to hai hi, but it has also failed to achieve its growth potential because of some pathological process. Now, which pathological process, everything I'm going to be talking about now, but this is what is the definition and the difference between FGR and small for gestational age. Now, there is something called as high risk FGR, which has not been specified anymore. So this is an obsolete term now. So all we have is SGA and FGR. So